We will talk about insulin resistance. It's extremely common condition. It affects almost 50% of US population. And what means insulin resistance? Normally, when we eat food, from food we get glucose. Food is absorbed in our body and glucose is produced from food. This glucose is small molecule. It reaches into cells, in our cells, and in cells this glucose is burned and we get energy. So eventual product is energy from glucose. We get glucose from food, and from glucose we get energy. To enter into cells, insulin is required. So for glucose to reach into cells, insulin is required. It looks like key and door. Key is insulin in this case. So key is required to open door for glucose. When this process is disrupted, when we have insulin, but this insulin is not effective, it is called insulin resistance. And when we have prolonged insulin resistance for prolonged period of time, we have lots of glucose in the blood because they don't reach into cells, and we have diabetes. We call it diabetes when we have persistently elevated level of glucose. So insulin resistance is pre-diabetic condition. It means if insulin resistance lasts for prolonged period of time, then we get diabetes. And diabetes have important complications, and it's life-threatening condition if not managed properly. That's why insulin resistance is very important. Now let's say what are the key early signs of prediabetes or insulin resistance. First, an important symptom is increased waist circumference. It's very important because it's highly associated with diabetes and insulin resistance, and it can be early sign of insulin resistance. And why? When person has increased waist circumference, even he is normal in his normal body mass, these fats, abdominal fats or belly fats, are metabolically active. These fats release fatty acids into body, and these fatty acids cause inflammation in whole body, especially in muscles, in liver, and they deposit also there, and they disrupt normal insulin function. So they causes insulin resistance. That's why we have inverse correlation that first is not insulin resistance in many cases. First is obesity or abdominal obesity or belly fat, excess belly fat, and after this we get insulin resistance because this fat is metabolically active. It means that this fat is not passive. This fat always release fatty acid into blood, and this fatty acid disrupts many processes. Also it includes chronic inflammation in the body. So first important sign of insulin resistance is increased waist circumference. And what is the normal or risky waist circumference? For men it's more than 40 inches, and for women it is more than 35 inches. It's around 100 centimeters in centimeters for men and 90 centimeters for women. And in Asians it's usually around 5 inches less because Asians naturally are slimmer. Second important sign of insulin resistance is elevated glucose level. And what means elevated glucose level at this case? It means when glucose level in the blood is more than 100 milligram deciliter but less than 126, because if we have more than 126 milligram deciliter, it's already diabetes. So pre-diabetic condition when we have high blood glucose level but not such high that we can diagnose diabetes, it is insulin resistance or it is pre-diabetes. It is sign of pre-diabetes or insulin resistance. Third most common sign of insulin resistance is acanthosis nigricans. It means that skin is brown and dark colored, and it's velvety, especially on elbows or armpits or at neck, So it happens because of high insulin. At first stages of insulin resistance, we have high insulin level. Why we have high insulin level? Because when glucose does not reach into cells, our body tries to compensate it and tries to produce more and more insulin, try to help our body to reach glucose into cells. And we have, at first stage, we have elevated insulin level, and elevated insulin level means that it acts more strongly on our body. And insulin also has action like growth factor. It means it stimulates growth of something, growth of cells at this case, and insulin stimulates growth of cells, and we get this growth of keratinocytes at this case, keratinocytes. They are type of skin cells, and we get acanthosis nigricans, which is characteristic of insulin resistance. And fourth important sign of insulin resistance, but not specific sign of insulin resistance, is high blood pressure. Why it happens? Because when we have high insulin level, insulin reduce excretion of sodium from kidneys, and we get more sodium in the blood. And more sodium means more water in the blood, because water follows sodium. Where sodium is, water follows there. So when we have high blood sodium level, we have high blood volume because of lots of water, and we have high blood pressure. And if person has high blood pressure more than 130 millimeter hydrogyrum, we get, or diastolic pressure is more than 90, we have hypertension, and we have suspect of insulin resistance. And skin tags are excess flaps on skin. Here you can see, and it is sign of insulin resistance also in many cases. Why? Because insulin is growth factor, and insulin acts on insulin-like growth factor receptors, and it stimulates growth of skin cells. That's a fifth important sign. Now let's say about treatment, insulin resistance. Treatment is crucial, because if you modify your external factors and your lifestyle, if you modify, you can avoid diabetes. You can cure from insulin resistance, because it's reversible in many cases. So you can treat completely. That's why early diagnosis and early treatment is very important. And what is treatment? Treatment is lots of fruits, lots of vegetables, lean meat, and less sugary products, less sugary drinks, less bakery products. Lean meat is important, high in fiber is important, and antioxidants, for example berries, are important, because antioxidants helps also insulin resistance. Exercise is another important factor. Exercise at least 150 minutes per week. It's at least. The more is the better. And losing weight is also part of treatment. If you lose more than 10% of your body weight, if you are overweight or if you are obese, if you lose around 10% of your weight, it maximally minimize risk of diabetes, and it minimize risk of progression of insulin resistance, and in many cases it reverse insulin resistance. And important medication for insulin resistance, and first line medication, first line treatment is metformin. Metformin is very important medication, and it acts. It has several actions actually, and first it decreases glucose production in the liver, it decreases absorption of glucose in the guts, and it improves insulin sensitivity. And it has many studies, and it's already confirmed that it's effective to treat insulin resistance and treat diabetes. So metformin is very important medication. Usually dosage is 500 milligrams per day, or 500 milligrams twice a day, and it's possible to increase the dosage of metformin importantly, but you should do it gradually. And also it's important that you should be informed that the adverse effect, especially for long-term adverse effect of metformin, is vitamin B12 absorption, and more rarely but very serious complication or adverse effect can be lactic acidosis. Lactic acidosis means when lactic is accumulated in the blood and our body is unable to excrete them. In normal cases it's not problem, but in people who has liver failure or kidney problems, they can't effectively excrete this lactic. That's why it's problem here. So metformin should be taken carefully in people who has kidney problems and liver problems. And from supplements, magnesium, chromium, and omega-3 has some studies that they can improve some degree improvement of insulin sensitivity, and alpha-lipoic acid also, and berberine also has some studies. Of course, they are not as strong as diabetic medications or insulin resistant medications, but they still have some effectiveness. They still have some studies. So if person is searching for safer alternatives, because they in most cases are much safer compared to chemical medications, then people intake supplements in many cases. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.